Well, good afternoon, everyone. Welcome to our November edition of Ask the Expert. We are here today with Jay Marks and Valerie Cotter, and we are going to be um, presenting on advanced care planning for a person with dementia. Our next webinar that we will be offering to just save the date on is December the 18th at 12:15. For the December and the holidays, we are going to talk a little bit about music therapy for patients with dementia. So we hope you can join us for that offering. I'm going to share a couple of resources, and I've put some in the chat for people to get to, but this presentation, PowerPoint, and resources will be made available to you after the recording today. It will be housed on our website, and you will receive an email that will give you access to all of the resources and the recording today. We do have a calendar of workshops to offer. We have statewide listings of both in-person and virtual workshops that are offered by the Center of Excellence as well as our partner agencies. They run across the state. We also have a hub statewide workshops where we are pretty much offering caregiving classes series every month. We have powerful tools for caregivers and building better caregivers, as well as some dementia workshops with Savvy. Um, we have this dementia series. If this is your first time joining us, welcome. We have had a series each month for 2025, and we are going to continue this into 2026. So if you want to put in the chat some ideas or topics that you'd like covered in 2026, we will be happy to address that. Our other partners that we do work with, the Alzheimer's Association, there's some information here for their 24/7 helpline. They do also offer some various apps now to get connected. There's an Alzheimer's Journey app that's available for free at the Apple Store and Google Play for your caregiving journey as well. I am going to introduce Jane Marks now. She's a RN and MS, and she's also the lead WEP educator. She's a nurse with the Division of Geriatric Medicine and Gerontology at Johns Hopkins. And I'm going to turn this over to you, Jane.
Well, welcome everyone. We're excited to bring this topic and have our expert speaker present today on advanced care planning for a person with dementia. Valerie has worked here and has firsthand experience, so we're so excited she's able to join us. Valerie Cotter is a doctorate of nursing practice, nurse practitioner. She is an associate professor, School of Nursing and School of Medicine, as well as Department of Psychiatry and Behavioral Science. She is the nurse practitioner at the Johns Hopkins Memory and Alzheimer's Treatment Center and is involved in the GUIDE program at the Johns Hopkins University. And I just want to say a few words about the GUIDE program because it's a new program put out through Medicare. Hopkins is not the only site in Maryland. There's other programs that are offering GUIDE, which is a new Medicare program. It's guiding improving dementia experience. It's to improve the quality of life for people living with dementia, as well as provide more support for caregivers and helps individuals with dementia stay at home longer. So certainly if you have any questions, I'm happy to answer any emails at jmarks at jhmi.edu. That's not our topic today, but I did think I would just bring up the topic since it is fairly new. So Valerie, we're excited to have you. Thank you so much for joining us. And we're going to get to the first question. If you want to show the next slide, Wendy. So our topic is advanced care planning. But what is advanced care planning and what are common types of documents that we see with that?
Great. Well, first, let me thank you for inviting me to participate in this exciting presentation. I really appreciate it. Advanced care planning, and you could flip to the next slide if you would. This is a consensus definition of advanced care planning. Rebecca Sidori at the University of Washington has done a lot of research in this area, and she defines it as a process that supports adults at any age or stage of health in understanding and sharing their personal values, life goals, and preferences regarding future medical care. And I just want to highlight the second word in that definition. It's a process. So it's not a one and done type of thing. It's something that all of us should be thinking about if we don't already have advanced care plans for our future health care. We should definitely be thinking about this, all of us. But what I'd like to highlight today is to really explain to you why it's especially important for people living with dementia. Next slide. So there's a few documents that we would consider advanced care planning documents, advanced directives and medical orders in advanced care planning. So uh, patient-initiated documents are a durable power of attorney for healthcare, where you name a healthcare agent, and you do that through an attorney and a living will. And then there's medical orders that are prescribed by either a physician or an advanced practice provider like myself. In Maryland, it's called the MOLST, and nationwide, it's called the POLST, or Physician or Provider Order for Life-Sustaining Treatment. And I'm going to go into each one of these a little bit more in detail. Next slide. I just wanted to give a little bit about supported decision making. When we talk with our family members and patients and families that we work with, we want to think about how do people make decisions, because I think for most of us, we don't make all decisions, especially important decisions. We don't make in isolation or independently. Excuse me. So we think about decision making as an approach to helping people understand, make, and communicate their decisions. An individual would select a trusted advisor to serve as their supporter. That could be a spouse, a partner, could be a friend, or some could be a lawyer sometimes. That supporter agrees to help the person understand, make, appreciate, and communicate their decisions. The healthcare agent is named by the person, and that person is a substitute decision maker if the person becomes incapacitated. So, like for myself, if I wanted to name a healthcare agent, if I had a car accident and I was in an ICU and I was unable to speak for myself and I was incapacitated to make medical decisions, that healthcare agent would be able to step in and make medical decisions for me. A decision-making supporter is a person who supports the person in making decisions. So, especially people living with dementia, they frequently and should be encouraged to have someone else who helps as a supporter in making important decisions. Next slide, please.
So can a person that has dementia participate in their advanced care planning?
Absolutely. Next slide, please. So, as far as advanced care planning for person with dementia, patients are assumed capable to make their own decisions unless a provider, physician, advanced practice provider notes otherwise via distinct documentation of incapacity after evaluation in the medical record. So, capacity evaluations, can be done by psychiatrists, physicians, advanced practice providers, neuropsychologists. But even when a person with cognitive impairment like dementia, their cognitive function may be compromised, a person may still be able to express important deep-rooted values underlying their decisions. So I like to think of this like, like a driving example. Just because a person has a diagnosis of Alzheimer's disease or dementia does not mean that they can't drive, right? There's different stages of dementia, and people can drive for a long time in the earlier stages, just like making important healthcare decisions. Patients can be involved especially in the earlier stages. And it depends really what you're asking them to make the decision about. There's a sliding scale of capacity, so a person can have capacity to appoint a decision maker despite their inability to make medical decisions. So, for example, someone even in the moderate stages of dementia who really can't like think into the future and think about a hypothetical situation where they would no longer be able to make a medical decision themselves could still be able to tell you, look, I've been married to my husband for 50 years, and that's the person I want to make decisions for me if I'm unable to do that. Next slide, please. The issue for the people that live with dementia is that timing is really critical. Because it's a progressive illness, the window for meaningful participation is limited to the earlier stages of dementia, requiring proactive identification and engagement. So, proactive identification and engagement really means that, the person has a medical diagnosis. They or the family have, taken them to a medical provider, had, a good evaluation, and a diagnosis has been made. Because many people in the earliest stages, whether it's not recognized by the person themselves or the family, they consider it's normal aging or what might be the issue. Many patients are not diagnosed in the early stages. So as far as decision making, that can really be a problem. People with dementia may struggle with abstract thinking, making future-oriented conversations more difficult, like that example that I just gave you a couple of minutes ago. Families and clinicians may also avoid advanced care planning discussions due to discomfort, uncertainty, or lack of training. I think I've been doing a lot of work in this area, especially in primary care settings and in my own practice at the Memory and Alzheimer's Treatment Center. And I think the more comfortable we are with the whole idea of advanced care planning and thinking about ourselves and our family and people that are important to us in our life, the more we're able to have conversations about that with them, and that we have our own advance directive, that will carry over to our work with patients and people that are in the community that we work with. So if we're more comfortable with the whole thing about advanced care planning, that will carry over into our clinical work. Cultural and personal factors can influence willingness to engage in advanced care planning. I think there's so many factors here. I mean, sometimes older adults are just not familiar with this whole idea, and they want to, of course, be as independent as possible throughout their life. And the idea of asking their children or their spouse to be involved in all of this, they worry about the burden on their family members. Excuse me. I think in some different cultures, the whole thing about, would one spouse be making the decision for the other? So, in some cultures, the provider talks with the family member ahead of the patient, not directly. So, you need to have some cultural humility and, get to know the person that you're working with to try to understand the context within their own situation and their living situation, and how best to engage with them in advanced care planning. Next slide, please. So why is ACP so important in dementia? Because there is a progressive loss of decision-making capacity. As we stage dementia, mild, moderate, and severe stage, especially when people get into the more moderate, severe stages, when they lose the ability as far as their instrumental activities of daily living and really need someone else to manage finances for them. They have, not able to drive, many of them not able to live alone anymore. That becomes much more difficult. And then definitely by the severe stage, a person with dementia does not have the mental capacity to make important medical decisions. We really want to respect the person's autonomy, right? Just because they have a diagnosis or just because they're in a certain stage of dementia doesn't mean that they have a certain amount of autonomy within themselves. And we need to respect and provide dignity to them, absolutely. And we need to also be thinking about the other people that are important to them in their life, their family caregivers or care partners, and provide support for them, especially because a person with dementia is going to name that healthcare agent or that person that's going to make decisions for them. Many times older adults make advance directives and they never tell their children that they've named one of their children as their decision maker. And that puts the children in a very difficult situation. So this is all about a conversation over time and really think about the person living with dementia as well as the family caregiver. ACP is important in dementia because it improves quality of care and reduces unnecessary interventions at the end of life. And so remembering that advance directives really do not kick in, until a person is at the end of life, the last 6 months of life or when there's, not too much time left. So thinking about unnecessary interventions in dementia, we don't think about feeding tubes anymore in people living with dementia for chronic long-term use, but thinking about, CPR, ICU admissions, those types of things, which may be unnecessary depending on the stage of dementia and the overall health and condition of that person. Next slide. So as far as caregivers, it's important that they have their own advance directive, right? As well as knowing what their loved one's advance directive is. And, to have ongoing discussions so that everyone is informed about what's important to each person. The caregivers need emotional and informational support. They need education about the dementia diagnosis and kind of what it's going to look like over time. As far as progression, timing, what are various treatment options at various stages, and then thinking about prognosis. They also need clear guidance on palliative care and end-of-life care pathways. And in my work, it's really important that we separate out. They're really not the same thing, palliative care and end-of-life care. End-of-life care is, the last 6 months or so of life, but I think we all really do provide a palliative care approach to people living with dementia because we're always focusing on quality of life because there is no cure for dementia. So we're always thinking about quality of life and quality of care for the patient as well as the family. Providing emotional support, including counseling, support groups, and respite services are so important for the caregiver who's taking care of someone with dementia. Next slide.
So once someone completes the documents, can they change it once it's been signed and witnessed?
Good question. Next slide. So an advance directive remains your choice and can be updated anytime while you are mentally competent, right? So what comes into question here is a person in the early stages of dementia that completes an advance directive who, later in the course of their illness wants to change it. A new document would need to be created, and then their mental capacity comes into question about whether they really have the capacity to really understand, appreciate, and make a different choice around that medical directive. So a new document would need to be created, clearly stating it replaces the previous one, needs to be signed and dated according to the state's legal requirements, often requiring a witness or a notary. And then the third point here is so important because, as we work with electronic health records, we sometimes see there's multiple advance directives in the chart. We're not sure which one is current, right? So we need to make sure that we have the most current copy and encouraging the family and the patient with dementia to distribute and to update that directive within the medical record, and that family members and healthcare providers have copies of the most recent copy, and to destroy old copies to avoid confusion. Next slide.
So what happens if there's a disagreement among family members with documented wishes, especially at the end of life? I know oftentimes in practice, we sometimes run into that situation.
Great question. Next slide, please. If a family disagrees about an advance directive, the medical team's priority is to understand the basis of the disagreement, right? So it's really our job to try to understand what's happening within the situation, what's the family's point of view here, as well as the patient, but the family. If it's based on new medical information or a different interpretation of the patient's wishes, the family's input is more influential. If agreement cannot be reached, this disagreement could be referred to a hospital ethics committee if it can't be resolved, or in rare cases to a court who may have to make the final decision. But we certainly try to avoid that as much as we can. A doctor or healthcare agent's role is to mediate and provide information to help resolve the conflict. Because sometimes, getting at what is the conflict through more discussion, there's a lot of information that comes up within those meetings, and family members, we would want to encourage them to explain to us what's happening and what's around the conflict. They may have information that we don't have. And we may have information that they don't understand yet, especially as I think about working with long distance family members, especially adult children who are involved and want to be involved, should be involved, but maybe haven't spent a lot of time recently with the person with dementia or the caregiver, and really not sure of what's, the current situation is. Next slide, please. So some of the key points that I'd like for you to take away is that advanced care planning is a collaborative and continuous process that is empowering to individuals, guides the surrogates or caregivers or surrogate decision makers, and improves care alignment with patient values. It helps to promote a dignified, person-centered care approach. Clinicians and caregivers must recognize the early stage of dementia as a crucial time for planning and ensure that conversations about disease progression and future care are approached with sensitivity, openness, and respect. Understanding the progression of dementia transforms advanced care planning from a checklist into a compassionate, forward-looking conversation that protects the person's autonomy and enhances end-of-life care. Next slide. So empowering caregivers through early advanced care planning, practical knowledge, and emotional support helps to ensure that individuals with dementia receive care that's compassionate, appropriate, and aligned with their values. Advanced directives and MOLST or MOLST forms are critical tools in ensuring that medical care is aligned with the patient's values, preferences, and goals, especially when they can no longer speak for themselves. Next slide. I think there might be one more slide or.
No, that's it.
That's it. All right.
Well, a lot of good points, Valerie, for sure. Are there tools for advanced care planning other than the MOLST and POST that you talked about that you're familiar with?
Mm-hmm. I think the 5 wishes is an interesting, very brief way to initiate a conversation, with a person living with dementia and their family members or whoever they want involved in that conversation. The Conversation Project is also another good resource. They have a resource specifically focused on people living with dementia that's also very good.
Yeah, so the 5 wishes are booklets that can be ordered online, but if anyone is interested on the call, if you email me, I can certainly mail you one. We have some. It's a nice booklet that kind of goes over your wishes that you can complete. I know some families that actually do it as a family project. They come together and they go through it. So feel free. 5 wishes. Also, you can go on the Maryland State's Attorney's Office, and they actually have more than one form, I believe, now on their website that you can print and complete, which requires usually 2 witnesses.
A link was just shared for the 5 wishes in the chat.
Okay, thank you, Wendy. Is any of our participants have questions for our speaker for Valerie, or do you have any comments you'd like to make about advanced care planning?
There was a question in the chat. Are advanced directives the same as do not resuscitate?
Hmm. That's a good question. I think many people have that same question. No, they're two different things. So an advanced directive, you could write in there your thoughts about CPR, whether you want it or you don't want it at the end of life. But it's not the only thing. CPR is also included in the POLST or the MOLST. But it's just one piece about thinking about medical interventions that you would want or not want at the end of life.
And we'll be sharing the MOLST form, I believe, with this recording on our website.
Yes, you can, I think, access that as well.
Okay.
Does anyone else have any comments or questions? Certainly you can write them in the chat, or Wendy, can they unmute themselves now?
Yes, they can unmute themselves.
I think one of the key points that you brought out too, Valerie, is if you do update it, because sometimes things do change, and that if you do update your advanced directive, that you do make sure that you keep the most current one prevalent and get rid of any old ones, and make sure whoever you've distributed to has the new one so it can be uploaded, because these are usually in primary care uploaded into your medical record now so that they're easy to access in Maryland, wherever healthcare facility you're in.
There was another question about are any of the tools in Spanish? I know the Alzheimer's Association has all of their materials in Spanish. I'm not sure about.
And Five Wishes actually has a list of languages that you can order, and Spanish is one. I'm not sure about the state's attorney's office one, to be honest, but I do think it probably could be also. Well, if there's no more questions, I'm not going to hold everyone up. We thank you so much for your expertise and all the great work that you're doing. And especially with Guide now coming out too. So we're excited about the Guide model and the support that that's going to offer families and persons living with dementia. So again, however we can help anyone, if you have questions, feel free to reach out. We're happy to help in any way.
And
And
I
we look
believe
forward.
we
Oh,
will do
I'm
a
sorry.
presentation on guide in our 2026 webinars to give a more thorough overview of that.
Great idea. Thanks, Wendy.
Hmm.
Well, thanks everyone for joining, and everyone have a great Thanksgiving holiday.
Great.
Um, don't eat too much turkey.
And you will receive an email after the recording from our website that to let you know that the recording as well as resources are available. Thanks again for attending today. We look forward to seeing
Thanks,
you in
everyone.
December.
Bye-bye.
Bye.